Well, good afternoon, everyone, and thank you for joining today's public update. I'm here today with Dr. Horace Smith, the pastor of the Apostolic Faith Church Ministry and also a doctor at Lurie Children's Hospital, Dr. Suzette McKinney, Executive Director of the Illinois Medical District and Operations Lead for our alternate care facilities all across the city of Chicago and the state, and Bishop Simon Gordon of Tridestone Church of Chicago, a full gospel Baptist church. I want to discuss the actions that I've taken toward protecting our more vulnerable populations, specifically focused on the Black community, who have suffered a vastly disproportionate effect of COVID-19. For months, years, and even decades after we defeat this pandemic, we will surely look back and examine the biological and medical questions about this virus. But beyond that, we need to examine what Americans learned about ourselves. The data accumulating over the last few weeks has shined a bright light on what seems like a uniquely American problem. Many could have told you what it would highlight long before the data drew the picture. Generations of systemic disadvantages in healthcare delivery and in healthcare access in communities of color and Black communities in particular are now amplified in this crisis. In the city of Chicago, suburban Cook County, in greater St. Louis, in cities and towns all across our state and our nation. First, we need more ubiquitous testing. We're working hard to expand our state testing capacity, and as we do so, we're thinking seriously about where and how these tests are available and to whom. To that end, my team and I have worked to set up a partnership between the downtown Lurie Children's Hospital in the city of Chicago and 4 federally qualified health centers on the city's south and west sides. These FQHCs, a designation given to community-based health centers that welcome those who are low-income, uninsured, or underinsured, are Lawndale Christian Health Center and PCC Community Wellness on the west side, and Chicago Family Health Center and Friend Health on the south side. Starting next week, these centers will take specimens for 400 people per day and send them to Lurie for testing. And in the Metro East region, we're launching a similar operation. Starting next week, 3 locations of the Southern Illinois Healthcare Foundation system will be taking 470 specimens per day and sending them to Anderson Hospital in Madison County. What Anderson and Lurie are doing, looking beyond their front doors to see how they can help, this represents the very best of Illinois. I can't thank them enough. No community is getting through this alone. The fastest way through is maximizing our resources across Illinois, and these hospital labs are stepping up to make that happen for all of us. I'm also excited to announce that our new state-run South Suburban Drive-Through Testing Center will open early next week in the Markham-Harvey area. We'll be taking hundreds of specimens per day, with test results coming back to patients much faster than the federally contracted labs. As for our existing 2 state drive-through sites, we've secured an extension of our federal contracts while we work to transition these sites to run entirely through state and local labs for faster test results. Testing is crucial. But we also need to talk about what happens after a person gets a test, or doesn't get a test but has symptoms, or has a known exposure to COVID-19. How does that person protect themselves? How do they protect their family members, their roommates, their loved ones? Across the state, we have multi-generational families living under one roof. And especially in our cities, we have families and roommates living in smaller apartment units that make self-isolating much, much more difficult. As part of our early crisis preparations, we required each of our local jurisdictions to come up with an alternate housing plan to help residents quarantine in a safe place. Simultaneously, we at the state level began preparing up to 2,000 hotel rooms outside of Chicago to support suburban and downstate communities. When a local health department needs help beyond its local alternate housing plan, we can open the provision of these hotel rooms for additional capacity. We have rooms available in Springfield, Rockford, Metro East, the Quad Cities, Schaumburg, Mount Vernon, Peoria, Carbondale, Quincy, Marion, Macomb, Champaign, and the Collier counties ready to be activated by next week based on county needs. We're also providing support to the City of Chicago and Cook County in their own efforts. These hotel rooms are for people who tested positive for the virus but have low-level symptoms and don't need hospital-level care. There are other rooms available for people who were exposed to a COVID-19 positive person and are therefore a person under investigation who may need to move out of their home as a precautionary measure to make sure that they don't expose their families or their roommates. This extends to our first responder communities especially. Local health departments will be making decisions about these housing needs. We've utilized the full weight of IDPH's clinical and technical capacity to bolster our local health department's COVID response, and we're now directing a combined $6.8 million to help mitigate every health department's financial stress during this crisis. I want to remind people that these hotel rooms are in addition to the alternate care capacity at McCormick Place, at Westlake Hospital in Melrose Park, Metro South Hospital in Blue Island, Sherman Hospital in Elgin, and Vibra Hospital in Springfield. Additionally, I'm very pleased that the federal government has granted our request to use the VA hospital system to support COVID-19 patients as medically necessary. I also want to recognize the Illinois Primary Health Care Association and its vast network of community health care centers who are working so hard across the state to support and improve the health of our residents. From cities to rural towns, these centers already played a critical role in public health through their support of many of our most vulnerable residents. And in the midst of a pandemic, they are one of the first lines of defense against COVID-19. This week, 45 community health centers across Illinois are receiving more than $51 million through the bipartisan Federal CARES Act to sustain their response to this virus. I also want to provide an update on our Abbott rapid test distribution. As I mentioned on Wednesday, Illinois received 15 rapid test machines. While we're still working to acquire the necessary materials to scale up their use beyond the 120 federally provided tests, we are deploying these machines in the following manner so that they're ready to go as soon as the new tests come in. 7 of these machines are going to the federally qualified health centers that I mentioned earlier, 2 each to Chicago's south and west sides, and the remaining 3 to East St. Louis and the surrounding region. Another 3 will go to the Illinois Department of Human Services facilities, the Ludeman Development Center in Park Forest, the Shapiro Developmental Center in Kankakee, and the Elgin Mental Health Center. And the final 5 will go to the Illinois Department of Corrections facilities, Stateville, Logan, Graham, Dixon, and Menard. To close, I want to say that we're making sure that our plans reflect equity in access, in testing, and in treatment. And we're asking the same of healthcare providers across the state. It is essential that healthcare institutions operate to fulfill their obligations to render healthcare in an ethical and non-discriminatory manner. This is a crisis, and providers may have to operate beyond their normal capacity and allocate limited healthcare resources. No one life is any more important than another. Today, we issued guidance that vulnerable and historically marginalized communities must receive equitable care so that no person of color or person with disabilities suffers a disparate outcome due to a legacy of discrimination. It's in moments like these that we owe each other, even greater expressions of humanity.